your deputy sheriff, your local PD, instead of spending 5 hours on the car crash, Highway Patrol does that. Your guys get to go focus on crime prevention. You get a state crime lab. In Montana, Austin talks a lot about drugs. If you want to convict someone for trafficking drugs, for example, you have to have a positive test from the crime lab that says this is in fact the methamphetamine substance, right? Well, if you gut the crime lab, you're going to delay results so much that prosecutors can't even take those cases to trial.
Is that what he wants to do, gut the crime lab?
Yeah, he wants to gut the crime lab. So the Montana Department of Justice plays a crucial role in providing centralized, highly professional services for public safety. And if we were to gut that, it would be a disaster. I mean, he's talking, and he said, oh, this is fake news. Now, you look at his own arguments. His arguments are, we should eliminate the funding increases under Republican Tim Fox. And I'm in this odd position of embracing a Republican in this race, but Tim Fox financed law enforcement increases. Increases went to crime lab, the law enforcement academy. And if you want good, professionalized law enforcement officers in Montana, what do? You fund the law enforcement academy. So his plan is off the rails, and the notion that he's the law and order candidate is just completely upside down.
Well, I was listening to another podcast recently, and I learned that he was a proponent of silencers on guns to protect the species of like not, I don't know, maybe grizzly bears, but can you talk a little bit about that?
Yeah, that the silencers for hunting idea is one of Austin Knudsen's many bizarre legislative ideas. I think perhaps his most bizarre was when he became Speaker of the House at a very young age. The very first thing he proposed a dress code applicable only to female elected officials that said things like mind your hemlines and skirt lengths. And this was not in 1815. This was in 2015. And in one sense it's ridiculous. In one sense it's silly. In another sense it's very telling, because when you give someone a position of great political influence, the very first thing they do with that influence tells you a lot about their priorities. And the first thing he thought he needed to do was regulate how female elected officials choose to dress. And that tells me a lot about the kind of attitudes he'll take to the Department of Justice. And from Austin, you've seen this pattern of political extremism, and it's had real consequences. I mean, he, at the height of the pandemic this summer, where most of us were doing events by Zoom and making sure to mask and socially distance, he went down to Valley County with a group of militia sympathizers to have a karaoke rally.
Teresa Manzella and
Fielder.
Jennifer Fielder.
Yeah.
And karaoke?
And it's interesting, if you ask public health doctors, epidemiologists, what is the most dangerous thing you can do for spreading an upper respiratory infection? They'll say screaming into a shared microphone. It's this sort of cavalier attitude about very serious issues.
So we can't have live music and everything. I interrupted you.
No, and that someone who takes that attitude towards the COVID crisis now wants to be the top law enforcement officer in Montana. And I don't think that's what Montanans want.
No. So, talk about the ACA and because I know that you've been to court to defend the ACA, and could you talk a little bit about that and what's coming up? I mean, I have some real personal concerns about the Supreme Court case after the election, because there's no backup plan. And they keep saying there's a wonderful, beautiful backup plan that it's secret. And so could you talk a little bit about that?
Yeah, they've had 10 years to show us the backup plan, and it's not materialized. I mean, healthcare is the biggest issue in this race, by far. It is the number one issue. Austin got into the race, in his own words, in order to fight to kill the healthcare law. I'm in it to stop that lawsuit. And you hear candidates up and down the ballot talking about the threat to the healthcare law, and that really does come from the Supreme Court case. Montana's in a really unique position. Our Republican Attorney General was one of the only Republicans not to join it. Montana's out of the case. Though it will be argued after the election, the uncertainty created by the vacancy on the court means there could be re-argument, And certainly we won't get a decision until probably June when these big decisions come out. So Montana's in this really unique position where we're having an election, the AG race, which is, by the terms of both candidates, a referendum on the healthcare law. Do we want to protect pre-existing conditions or rip away protections? You go down the line. Montana, on day one in the Attorney General's office, should file a supplemental brief saying we are in this case now, and we have debated this as the public, and here are our views on protecting the healthcare law or not. And that's why I think this race is so important, because we are the kind of litigant, the kind of state that the Supreme Court will listen to, because they're curious about what's going on, how are people viewing this lawsuit. It's been around for a long time. We're weighing in on it in this race, and I've gone all over the state talking to healthcare leaders about in really concrete terms, what would this lawsuit mean to you if it succeeded? That's what we're doing later today. In Missoula, Providence, St. Pat's says that if the lawsuit succeeds, all of their investments in mental health care in Missoula could potentially be on the line and at risk. And so it's fair to say mental health in Missoula is on the ballot in the Attorney General's race. The infrastructure involved in having Missoula be a level 2 trauma center is very expensive and it's very hard to maintain. And if the ACA goes away, healthcare law goes away, having Missoula be a trauma center is on the ballot. That could go away. You get in a car crash in Ravalli, you might have to go to Idaho when time is of the essence. You might have to go to Great Falls when time is of the essence. So I think it's very easy for political extremists on the hard right to talk about this case in abstract terms, but in terms of communities, it's really concrete. Having a level 2 trauma center in Missoula is a big deal. Losing that would be a big deal.
Not to mention the rural hospitals.
We haven't lost it.
Yeah.
Missoula is better able to handle it than basically any other hospital system, and they still have these kind of other hospitals in Montana just close, right, or lose a substantial amount of services. I was up in Havre, and they said they would close down a third of their beds. They would have moved dialysis to Great Falls, move a lot of specialized care to Great Falls, and if you need dialysis every other day, and you live in Rocky Boys, you're going to be driving 2 hours each way every other day instead of just going into Havre. And if you live in Chinook, outside of Havre, your clinic is just going to be gone. No more clinic. The other thing that's interesting too about the ACA, I hadn't heard before today, but it stands to reason. The number of premature babies delivered in Missoula in the last 10 years has dropped dramatically. The number of unhealthy babies in Missoula delivered has dropped dramatically. And that's because of the ACA. The ACA has gotten people covered. It's gotten people access to care. And when you know that you can have coverage, you'll make those appointments, those preventive care appointments. And so the ripple effects of ripping this law away aren't just acute things like losing mental health care, like losing trauma. It's the preventive care that we all know, going to the doctor routinely, that makes a population, a community healthier.
Right.
And that's all on the ballot in this race.
Well, it seems like we're always trying to catch up, and the prevention is what we need to do. We need to prevent disease from getting worse, and we always seem to be catching up with that, and it's really frustrating.
And we fall behind. I mean, we were talking about criminal justice earlier. It's the backside of the healthcare issue. Every single criminal justice conversation I've had in this state, in this election, whether it's with law enforcement, whether it's with providers, community activists, everyone has good ideas about their area, but every conversation ends with, and we have to invest in mental health. We have to do better in mental health. That is the prevention tool. Well, biggest hospital in Missoula is saying you lose the healthcare law, you lose all their investments in mental health. And it has this ripple effect on all these other issues that matter to people.
Well, and it seems like, with all the writing and whatever that has been going on about defunding the police and everything, it's not reallocating funds to go more towards mental health. They have different groups that work together to bring a team of mental health people or whatever is needed at the time. And I think that's kind of an important part of it to look at too. Part of the bigger picture is making sure that people that are having a healthcare crisis get the care they need. And what are your thoughts about that?
I don't support defund the police,
Right.
because I reject this zero-sum idea.
Mhm.
You have to take money from some services and give it to the other. I don't think that's how politics should work.
Mhm.
I will be the first person in line with the legislature to argue for real investments in treatment
Mhm.
and real investments in prevention. And prevention is a huge part of my campaign through this ACA lawsuit. I don't think taking officers off of, out of community rotation is the answer to get there. I think that's the wrong answer. You talk to folks in, in Great Falls, right, where I grew up.
Mhm.
They are really excited to have a conversation about better social services.
Mhm.
But no one thinks the answer is you should reduce the size of the GFPD. Everyone thinks we should reduce the burden on the GFPD so that you can have better provision of the frontline services to people. But cutting law enforcement isn't the way to get there.
Yeah. So, what other issues did you want to touch on today before we know you have to go? But I just wanted to make sure we covered everything that you wanted to get out there.
There's two other issues I'd bring up, because I think they represent really what you started with, which is the breadth of this office and how this office can affect your life in a very real way. I mean, healthcare, it's obvious, right? The issue of prescription drugs. Again, this is like healthcare, every candidate's talking about it, but if you look at where in America right now, there is actual meaningful progress on reducing the increasing price of prescription drugs, it's AGs that are doing it. It's not the legislature, it's not Congress, it's state AGs. And what AGs have done is and we've all experienced this, like, I buy eardrops for my daughter who gets ear infections. $50 for a little tiny bottle, right? That's not because of economics, right? That's because of conglomeration in the healthcare markets and in the pharmaceutical markets, right? And AGs across the country have launched investigations using the power of their office and have found that oftentimes, oftentimes generic manufacturers might be working together to keep the price of a drug high or support increases, or abuses around patents where certain drug manufacturers who own a patent pay off the generic, the way the drug law works, one generic gets a monopoly, then all the generics come out. Pay off the first in line, then pay off the second line to delay the entry of a generic drug. And all of that, I look at that as a form of theft from us and theft from our employers to pay for our healthcare plans. You meet with insurers in Montana, and they say the portion of money they're paying out for pharmacy has gone up and up and up and up and up. And that's because of, in large part, a lot of these illegal business practices that drug companies do because they can get away with it, right? They know that no one's going to catch them. But it has historically been the role of state AGs, particularly when the feds are asleep. The feds should do something, but they're asleep, not doing anything, right? But it's been the role of state AGs to come in and say, price fixing, price gouging, monopolization, illegally paying off competitors. It's been illegal in America for 120 years. You don't write a law on that. That's illegal. Let's do something about that, and let's recover money that ultimately was taken from you and from me. And that's a way. And that's that issue I hold up as an important issue because it doesn't show up in a traditional red-blue sense or left-right sense, right? It's not like on cable news every day, but it's in our wallets every day, and it's in our lives every day, and it affects everyone in this country. You can be rich, you can be poor, you're probably paying too much for your prescriptions. And that to me is what makes this job so exciting, is its power to affect real change in people's lives in ways that are incredibly tangible and incredibly concrete.
Well, yeah, prescription drug prices and healthcare prices are just insane. And I remember when Brian Schweitzer had his Canadian trip, bus trip and stuff, and it seems like not much has changed since then.
Like he saw the same things we're seeing today.
Yeah, definitely. Well, Ray, thanks for coming today.
Thanks for having me. I appreciate it.
As we continue on our journey of conversations with the candidates, it's great to have you here.
Great to be here. Thank you so much.
Good luck on the trail.
Thank you.
Okay.
Take care.